Next thing we're going to speak about here, the last part of this topic, is platelets and hemostasis. Okay, there are three components to understanding blood clotting. There's vascular spasm, there's the initial sort of temporary platelet plug formation, and then there's the official blood clotting, which is a much more permanent, long-lasting part of blood clotting. So when we have damage to a vessel, this brings about an initial reaction of these vessels, which is called vascular spasm. And this is seeking to constrict the blood vessel and minimize the blood loss, okay? It's an intrinsic sort of inherent property of vessels. And so this response is mediated through the sympathetic nervous system. And it's basically forming a sticky endothelial layer that helps with preventing excess blood loss, but also starts the process of the more permanent part of blood clotting. So the endothelium becomes sticky as a way to attract some of the components that are circulating in the blood to start aggregating at that site and begin to heal that damaged blood vessel, okay? So vascular spasm is really the initial sort of reactive or responsive part of blood clotting that is initiated within the vessel itself, mediated through the sympathetic nervous system. The second layer here is what we call the platelet plug formation. And this is not, fully permanent as the third process that we'll speak about, but it's a little bit more permanent than just the vascular spasm and the stickiness of the endothelial layer there. And so what we see here are platelets, and platelets, remember, are these fragments or these non-cellular components, also called thrombocytes. They're circulating in the blood, and they start to aggregate at the site of that vessel injury or that damage to the vessel wall, okay? And what this does, again, is it starts to minimize how much blood is being lost, but it also starts to form the initial layer of a more permanent platelet plug or a more permanent blood clot that will eventually heal that vessel wall. Now, the platelet components are colorless. They are fragments of a cell. So remember that large megakaryocyte that we talked about earlier will then kind of explode into these fragments. There are no nuclei in platelets. They do have very small organelles, mainly granules that help to contain some of the secretory products that are, again, required for that platelet plug formation. Now, there are many platelets in blood, about 100,000 to 500,000 platelets per cubic milliliter of blood. And so they're a really vital component of blood clotting. And I really want to reiterate here that they're just kind of circulating in the blood at all times, right? And this makes sense, right? We don't know when you're going to have a vessel injury, right? When you're going to have some type of damage to your vessels. And so having these components always circulating in the blood allows for a really nimble response, a really quick, immediate response whenever we do have some type of injury to the vessel wall. Okay, so here's here's a flow chart that kind of explains that initial platelet plug that we have being formed. So essentially we've got damage to the vessel wall. We then have exposure of the subendothelium. So the subendothelium is pretty much the basement layer of that endothelial vessel, that endothelial cell that forms our vessels. And that exposes that layer such that von Willebrand factor, which is a factor in our blood, can bind to the collagen fibers that are exposed in that subendothelium, okay? So it really creates this sticky environment for platelets to bind to that von Willebrand factor and begin secreting some of the other components that are required for a more permanent blood clotting to happen and really permanently seal that injury, okay? So let's walk through those steps again. So we have injury to the vessel wall. We have exposure of the subendothelium. This triggers von Willebrand factor, which is circulating in the blood, to adhere to the collagen fibers that are exposed in that subendothelial layer. And then when that von Willebrand factor binds to those collagen fibers, that creates this sticky environment where platelets will now begin to aggregate at that site, okay? So we now see that sticky environment being created, platelet adhesion being created, and then further secretion of some of the other components that are needed to begin that more permanent sealing or healing or clotting to heal that site of vessel injury. Okay, I'm seeing a question here. Is it healthier to have a lot of platelets in your blood? So it's healthy to have adequate amount of platelets. I don't know how you would get excess amount of platelets in the blood, but even if there were excess amount of platelets, they would not necessarily create any type of damage or injury to the blood. So the answer is yes, it's healthy to have adequate amounts of platelets in the blood. Okay, another question here. So with blood thinners, does that reduce the amount of platelets in the blood? So blood thinners actually, yes, reduces the amount of platelets. It makes the blood more fluid, and it decreases some of the factors, which we'll talk about a little bit later on. And so it makes it harder for this process to take place. So really good question. It makes it slightly harder for the clot formation because it decreases the ability of platelets to aggregate onto each other, as well as the number of platelets that are circulating. Okay, some really good questions coming up here. All right, and so, so the initial process here, we've got the aggregation of platelets. They start, jumping on to the site where we now have that sticky von Willebrand factor. And they're going to start releasing some secretory products that are needed, again, for the healing of that vessel injury. So the first one is called ADP, adenosine diphosphate, and that is going to increase the stickiness by a positive feedback, and that will also help with the further aggregation of other factors that are required here. We also have the secretion of serotonin, and serotonin is going to cause vasoconstriction. So is epinephrine. So both of these things will help to decrease the amount of blood that's being lost by causing that smooth muscle layer in the vessels to constrict, which will decrease the lumen size and decrease the amount of blood flowing to the area or to the region. We also see some chemicals that are helping to facilitate blood coagulation, as well as the production of thromboxane A2. Now, thromboxane A2 and ADP are being produced in a positive feedback mechanism. In other words, the more ADP and thromboxane that's produced, the more we have that aggregation of more platelets, the more of these things that are secreted, right? And that just keeps happening and is just potentiated until we have lots of platelets being aggregated and lots of this ADP and thromboxane being secreted by positive feedback. Okay, so this is one of those rare examples in our physiology where we do see very temporary positive feedback loops for a very short period of time, and then that feeds into a larger negative feedback cycle. All right. So I'm going to kind of pause here, see what questions you have. I don't want to get too deep into this. As we talk about that third, more permanent process, we'll kind of pick that up next time, and then we'll get into a review with the remaining time on